Colorado is an island of access to abortion, surrounded in large part by a red sea of Republican states that limit access. You'll soon see a ballot question asking you to put abortion rights in the state constitution and allow some state tax dollars to pay for certain abortion services. Politics guy Marshall Zellinger continues our series, Decision 2024, The Stakes for Colorado, with a look at what happens if Amendment 79 gets the 55% support it needs to pass.
Ballot helps provide financial assistance for abortion care. It's also providing significant financial assistance, $2.3 million, in support of Amendment 79, the constitutional right to an abortion. A yes vote on Amendment 79 would put unrestricted abortion access into the state's constitution. With the signature of Democratic Governor Jared Polis, the right to an abortion was put in state statute 2 years ago. So Amendment 79 does not change abortion access, it just moves it into the Constitution, requiring voters to make future changes instead of state lawmakers. A yes vote would also repeal the current restriction on using public money for abortion care. In other words, a yes vote would allow for state and local tax dollars to pay for abortions through Medicaid or through a government employee's health insurance plan. A no vote still means there is the right to an abortion in state law, which could be changed by future legislatures. A no vote also means public funds still cannot be used for abortion services. Here's how a yes vote could impact tax dollars. Medicaid is funded by the federal government and the state. The Congressional Hyde Amendment only allows federal Medicaid tax dollars to be used on abortions if the mother's life is at risk or if the pregnancy is from rape or incest. The states in orange follow the Hyde Amendment restrictions. Colorado is one of them. The blue-colored states allow state funds to pay for abortions under Medicaid. Amendment 79 passing does not automatically make Colorado join the blue states, but if passed, state lawmakers or local governments could pass legislation allowing for state and local dollars to pay for abortion access through Medicaid, something the current Colorado Constitution restricts. If the state approved public money for abortions for Medicaid patients, it could cost $800 for a medication abortion, $1,000 for an abortion in the first trimester, and $1,600 for a second trimester abortion.
The State Blue Book does not give any tax dollar estimates for this amendment because it would require state and local governments to act should Amendment 79 pass. But don't be fooled because there could be financial implications to a yes vote. It just depends because if you have states or local governments suddenly changing their insurance plans for their government employees, that could mean premiums go up. So yeah, some extra tax dollars would go to pay for that insurance because now that state employee's insurance could cover an abortion where it currently cannot.
Because the access would look the same in both cases, is it just as simple as saying, like, this is the state law and we're going to move it under the umbrella of the Constitution?
Well, the first part, so yeah, don't be fooled that all that's happening is moving something that state lawmakers did 2 years ago and putting it in the Constitution. That's happening, but also it's crossing some part of the Constitution out that says you can't use these public funds to help pay for abortion services. They're getting rid of that also. That currently does not exist.
All of this goes into our voter guide on 9news.com where all of our stakes reporting is for viewers to see it. Marshall, thank you.